The Ministry of Health launched an HIV counseling and testing campaign in 2009 dubbed Go Together, No Together. The campaign targets married and cohabiting couples and is meant to encourage them to get tested and counseled together. The ministry officials, working under the AIDS Control Program, launched it after a study indicated that 65% of new HIV infections occurred among married couples. It was ultimately meant to reduce new HIV infections and provide information on how HIV-positive and discordant couples could avoid contracting the disease. Our journey to Rubaya in Mbarara district led us to a couple that has been living with discordance. Johnson Karugaba and his wife Harriet have 6 children. Karugaba is the only one living with HIV amongst his family. He says the journey has not been an easy one for them because of the stigma surrounding the disease.
Ubuwire abokuba automatically kana bajangu kukushanga abo bakana bageta sirimu bashango ine sirimu kumbazi kujya hife yortochi nukufa.
Karugaba got to know his status in 2002, but he believes he could have been living with the HIV virus since 1999. He suspects to have contracted it in an accident he was involved in back then. In 2005, he mustered enough courage to take his wife to the AIDS support organization in Mbarara for an HIV test.
Kutwashiraha anyureka results ze shangawe ara negative. Hati chitwakozire mugambira amazomo. Tebintu nyowe biri bitanabiti. Ati chikubasuka.
His wife could not believe the results which showed her husband was HIV positive.
The
couple sought counseling services at Wiziwera Health Center 4. The health center is supported by Makerere Joint AIDS Program. Dr. Joy Mohindo is the medical officer in charge of the ART clinic here. She explained to us how discordance happens.
It is said that one person may have a strong immunity. You find that the virus does not easily get into their body cells.
Joy says their center receives many discordant couples on a regular basis.
As of now, we have 310 discordant couples.
She told us what they take such a couple through.
There are quarterly meetings for such a people, for psychosocial support, and also knowledge on what discordancy is.
For discordant couples to stay safe, the positive partner has to ensure that their viral load is very low.
This viral load we are talking about is that virus which is in the bloodstream that is active, and actually it's the most important active virus that is involved in transmission of HIV from one person to another.
Dr. Dan Natureva, the disease technical advisor at MJAP, told us why they advise the patients regularly about viral load testing.
If someone's viral load is almost undetectable, even the risk of passing the virus to a different pattern is almost eliminated. Actually, statistics say the risk could be reduced to as much as over 98%.
It is for this reason that for every couple tested and verified to be discordant, the positive partner is immediately started on HIV treatment.
Whether your CD4 is very high, whether you are whose stage is 1 or 2 where you don't need ARVs according to that criteria, you will be given ARVs so that there is suppression of the viruses.
Karugaba says this intervention helped him wade through the threats and negative comments that he got from his community.
Nanka alliances no mana takuza kuchira nakufa mbwenu ebitoki mutebe mugireki musugumu mukwarafe yatsubone ibyo kukoze sorfu.
Dr. Joy says virus suppression does not mean one cannot transmit HIV to their partner. She counsels couples to stay faithful not just to their partners, but also in taking the prescribed medicine.
Might be using a protector, you're taking your ARVs, but you find you're moving out with other sexual partners, not knowing their HIV status, or not knowing that they have other STDs, and you bring them along.
The couples are also advised against having unprotected sex.
We advise them that the choice is yours. You have to first share these two between yourselves, because bearing in mind that that risk is still there. It's possible the other negative partner can get the virus.
Dr. Joy also shared with us the challenges they go through at the clinic.
Understaffing. The workload keeps increasing against a static staffing. Like here we have a cumulative number of about 8,000 patients. The active, you find 5,000, but we are 3 clinicians handling, and when one is on leave, like the way it is now, you find there's a lot of workload. Facility store has very little space, so there would be need for extra space for proper storage of these drugs and other supplies, and also where to see these patients from. So there are times when you'll find that maybe this clinic is running in the morning in the same room, then maybe at some other point someone is seeing patients from there.
There is no current research that has been done to establish the number of discordant couples in the country, but the number of people living with HIV and AIDS has shot up from 1.2 million people to 1.5 million within the past 5 years. We are at the family home of the Karugabas here in Rubaya, Mbara district. They have been living together as a discordant couple for 12 years now. They have made it, and you two out there can make it. The only advice they have given to us is that they agreed and accepted to live together as a discordant couple. They got counseling and guidance. Test yourself for HIV and AIDS. Discordance should not mean an end to your relationship. Mwesije Walter, NTV.